Thank you. Any questions for Dr. Ritchie? No? Okay. Thank you. Okay, next up, I'm going to invite Sharon Gill to the podium. Sharon is new to our team at Total Health Conferencing, and she's going to present the importance of empathy in cancer care, and she's going to share her personal experience.
Thank you so much, Raina. Well, Sylvia, I'm glad that story is not going to be my story, because I'm going to talk about my journey. I'm a recent breast cancer survivor, and I want to talk about the importance of empathy in healthcare, and I'm going to give just my personal journey. But before I get started, I just want to say to all of you healthcare providers, I appreciate you. I appreciate what you do for patients like myself, and I appreciate you taking the time to be here to continue your own personal development and learning and growing, because it's so important. When you look at me and you look at your patients, this is why you sign up to do what you do, right? So, as someone who has been through cancer treatment, I know firsthand just how difficult and overwhelming the experience can be. It is a roller coaster of emotions, with highs and lows that can change from one moment to the next. During this time, it is so important for patients to feel seen and heard and supported by their healthcare providers. Empathy is a crucial component of this support. It is the ability to understand and share the feelings of another person, to put yourself in their shoes. And that sounds, it's easier said than done, but that's kind of what we as patients would like you to do. And to respond to us with kindness and compassion. And in the context of cancer, empathy can make all the difference in a patient's experience. One of the most challenging aspects of cancer treatment is the feeling of isolation that can come with it. Patients may feel like they're facing this battle alone, even when surrounded by friends and family. But when healthcare providers show empathy, they can help to break down those barriers and create a sense of connection and understanding. And I want to begin my journey here. I want to begin my journey from that phone call from the radiologist's office. I was expecting it. I had gone in for my mammogram. They'd seen a lump, they'd done the biopsy, and now it was time for the results, and I was waiting. And when the phone rang, I said to my husband, I need you to be with me because I don't know how this is going to go. You always expect the worst. And when the phone call came in and the woman on the other end of the line said, Mrs. Gill, just want to let you know that your test came back and it was positive for invasive ductal carcinoma. I'm like, what is that? She said, that's cancer. And my husband said, wait, are you sure? And I just thank God for her attitude because she got it. She understood that we were just in a state of confusion. She said, yes. And my husband said, but really, are you really, really sure? And she said, yes, it's 1.4 centimeters, and you're going to have to come in to see the breast doctor. And so I was just appreciative of how, while my husband kept pushing back at her, how she just remained calm and empathetic because she understood that this is the kind of news that requires compassion. So our next visit was to the breast surgeon. And what I remember about that day is that she took the time to sit in the middle between me and my husband, and she had a piece of paper with a copy of a drawing of a breast, and she said, okay, this is where your cancer is, and it's slow growing, it's early, and she explained all the scientific stuff, but in ways we could understand. And she said, look, you're going to live until you're 90 years old. And of course, we know that no one can really guarantee that, but she began to put that in my mind. And she said, I said, what does invasive mean? I mean, does it mean that my body's invaded? She said, no, that's just a term that we use. Because these, doctors say these things, but when you hear the word invasive, you're thinking of invasion, right? Like your body's invaded. And she was able to really explain everything, what was going to happen. She said, you're going to need radiation, but you may or may not need chemotherapy. And she's still sitting between me and my husband like she's one of us. She was at our level. She was matching our tone, our pace, and she was being very loving. And when she said, "You're going to be killed by something else, not this," I mean, I just had to hug her, right? Because I just felt that kinship. And she said to me, "I'm going to set you up with 3 excellent people to care for you. And I want you to go and meet with them, the oncologist, the integrative oncology, and the radiation oncology." She said, "These are people who I highly recommend, and I want you to go and meet with them." And I said to her, "Listen, what's going to happen?" When this surgery was within a month, I was diagnosed during the Thanksgiving holiday of 2021. So I'm like, man, I was supposed to go to Florida for Christmas. Am I going to be able to go? She says, "Go. It's going to be better for you to go and be with friends and family and have your mind relaxed than to be thinking about what's happening." Again, she made me feel like it was okay, that I was normal. Even though this terrible thing was in my body, I was normal. It was normal. My husband, I could feel the sigh of relief from him, like, okay, this is bad, but it's not going to be the end of the world today. So we went to the next leg, which was with our radiation oncologist. And he walked in the door and he was like laughing. And I'm like, okay. He's like, "Girl, we're going to kick this cancer in the butt. It's wimpy." And he said, I've seen your notes. I've seen this stuff. We're going to kick this. It's going to be okay. And so he began to just, again, bring the tensions down. He showed us a video, says, "This is what you're going to look like when you come to radiation. You're going to be in this thing, and here's how it's going to go." And he just kept affirming and reaffirming, like, "You're going to be okay. This is caught early." And I remember when he left the room and his nurse came in, and we were talking, and I'm a person of faith. So I may have mentioned something about God, and she identified with that immediately. She said, "Oh, you're a person of faith?" I said, "Yes." She says, "Okay, I am too. And if we both believe in the big man upstairs, we can pray for good outcomes." And I just want to say this to doctors, 2 things. Sometimes you meet a doctor with a great bedside manner, but sometimes his nurses and others are not the same, or the front desk people. And I just want to say, in your training programs, take a look at that, because you may be amazing, but I don't want to come to your practice because I don't want to go through the front desk person or the nurse. But this nurse had the same attitude. And the second thing I want to say is that there are patients whose faith means everything to them, especially during a cancer diagnosis or any other serious disease. And I would love for you to hold space for that conversation. Even if you don't agree with their faith, and it could be whatever faith. I'm not here saying it has to be this faith or that faith, but any faith that they have, I'd love for you to hold space for when they say something about their faith, because sometimes that's the only anchor that they have. And then, so my next stop was finally to my integrative oncologist. And again, she was a 16-year breast cancer survivor. And that, again, was an instant connection for me, because I'm like, okay, so what is my age now plus 16? Okay, maybe I'm going to get, this is the kind of things that we think about, right? We think of, and that's why survivor stories are everything, because if she can live 20 more years, maybe I can too. Because what we see on TV is like, they're dead. And everyone's dead on TV, right? I mean, I had PTSD for like 8 months, because every story was somebody dying of cancer. My husband and I are sitting there, and I'm like, oh my God. But when you see a 16-year cancer survivor doctor saying, hey, we're going to be okay, we're going to look at the diet, we're going to look at the exercise, we're going to look at the meditation, it was just such a cohesive, I felt like such a cohesive care for me. 4 months later, I ended up back at my primary care physician. And when I walked in, and I love this man, when I walked in, he said, you've had a very busy 5 months, because he had the report. And he said to his nurse, Mrs. Gill had a very busy time, but thank God she is now in remission. I'm like, what is that? I said, I'm in remission? Because no one had ever explained this part to me. He's like, yeah, they found it, they cut it out, and it's not there anymore. You're in remission. So I hugged him too. I mean, hugs all around, because this is a kind of assurance that you need. And I'm just so thankful for him, because it was him in the first place who had recommended my breast, for my mammogram, and then told me who I should go to for the follow-up stuff. And so I just want to say, for the doctors here. And I heard that story that Sylvia said, and it's pretty much the opposite of my story, where there was such a lack of communication. And yes, my doctors were all part of one system, so it was easy for them because they all were on the same network. So it was very easy for them to read notes. But for those who are not on the system, I would just implore you to find a way to make these relationships with these oncologists and these radiation people so that you can be that guide somehow. Because it's such a difference when you feel like everyone understands you. I mean, that story that Sylvia told about the miscommunication, it could have cost someone their life, right? And it was such a delay in care. I had an exceptional experience. Now, the PTSD, you know, after 1 year, you got to go back for that checkup again, right? So I went back, you know, God, you know, my faith, everything. I'm like, okay, Lord, I don't want to see any more lumps or whatever, you know, on my breast. And I remember the doctor who read the report from the mammogram same day, she came into the room because she was one who had seen the cancer the year before, and she said, I wanted to come and tell you personally that you're clean in both breasts, and we just hugged. And I talk about my journey because this is what I would love to see for every woman, whether they're black, white, rich, poor, old, young, for every single woman. And what I love about my particular care is that I can email my doctors at any time and ask them a question and get a response within 24 hours. And because we have so many questions, because once you've had cancer, everything is an issue. If you have a bump, it's like, what is this? This is cancer, you know? So I'm just, again, thankful that you guys are here and you guys are just so willing and open to learning how we can do better as primary care and how we can collaborate better with our oncologists. Because at the end of the day, patients are just like, this is me. So thank you so much for your time. Thank you so much for being here.